Basilar impingement is a pathological condition in which the structures of the cervical spine, most often the dentate process of the second cervical vertebra, less often the atlas or other cervical vertebrae, are displaced upward, disrupting the normal anatomical relationships at the border of the spine and the base of the skull. This leads to compression of important nervous and vascular structures of the brainstem and upper spinal cord. Symptoms of basilar impingement are diverse and depend on the degree and localization of the compression. Most often, patients experience headache, neck pain, dizziness, nausea, impaired coordination of movements, decreased sensitivity and strength in the arms and legs, as well as paresis or paralysis of the cranial nerves. Neurological symptoms: atactic gait and impaired coordination, weakness or paralysis of the limbs, numbness or tingling in the limbs, headache in the occipital region and neck, symptoms of brainstem involvement, difficulty swallowing, speech disorders, double vision and tinnitus, brief loss of consciousness, occurs with sudden head movements due to compression of the vertebral arteries. Diagnosis is based on clinical examination and instrumental methods that visualize the bone structures and soft tissues of the craniovertebral junction. Conservative methods are used only in patients with mild or no neurological symptoms and in the absence of cervical instability. Analgesics and anti-inflammatory drugs, to reduce neck pain. Wearing a rigid cervical collar, to limit movement and prevent deterioration. Traction, stretching, can be used to temporarily reduce compression before surgery. Surgical treatment, main method. If there are neurological disorders or significant compression, surgery is necessary. Decompression is aimed at eliminating pressure on the neural structures. The main goal of surgical treatment of basilar impression is to eliminate compression of the neural structures and vessels at the level of the craniovertebral junction, restore normal anatomical relationships, and ensure stabilization of the spine in this area. Rehabilitation after correction of basilar impression, usually after surgery, is critically important for restoring lost neurological functions.